I think we'll start. It's noon on the dot. So good afternoon, everybody, and welcome. I'm pleased to present our webinar today, which is called Heads Up for Healthier Brains. And our focus today is to learn about dementia and also to learn about things we can do to improve our own brain health. So it's a really interesting presentation and interactive, so I hope we can learn from each other. My name is Anita Luby, and I'm a CSS dementia educator with the Alzheimer Society Southwest Partners. Susan Oster, who's another public educator, is online, and she's going to do our tech support, which will be wonderful. The Alzheimer Society, our role is to provide programs and services and dementia education, and also to support people with any cognitive disability. So a little bit about our webinar. We will, it is recorded and it will be archived on our YouTube channel on our website, which is excellent for anybody that misses it or wants to revisit. We have a great technology today. So we have the option to ask questions at the end of the presentation, and you're welcome to submit questions anytime by clicking on the icon at the bottom of your screen, the Q&A. We also have an option to, I guess it's called upvote. So if you see a question that is interesting to you and you would like it asked, you can give a thumbs up and that will move the question to the top. We do have a small group today, so I'm thinking we're going to get to all the questions. Susan and I will stay on afterwards for any one-to-one questions, but I would say we would have a good 10 minutes to talk things over at the end. How the chat works is, for most of the presentation, Susan and I are the only ones that can see it. So if you have any technical difficulties, just put a note in and Susan will help you. There is a couple times where I will ask a question that will go in the chat and that will be public, but for the most part, if I'm not asking a question, it's private. So a disclaimer about today's presentation. We recognize everybody's situation is unique, and I'm really sharing information for educational purposes. If you have a specific question about a personal situation, yours or somebody in your care circle, you can call the Alzheimer Society and we will gladly support you on that. Or if you're already connected to us, you just reach out to your support worker. Okay, so today our outline is to talk about our dementia stats to give us some perspective. We'll talk about what dementia is, risk factors so that we all have an understanding of both modifiable and non-modifiable risk factors. And we're also going to talk about different ways that you can improve your brain health, have a healthier brain, and that is the interesting part. We'll circle back to the Alzheimer Society Southwest Partners, our programs and services. We're always wanting to promote our services so that if people do need help, they know who to contact. So the stats. We know that there's over 600,000 people living with dementia in Canada. We have, our prediction is that by 2030, there'll be over 1 million people. Some stats closer to home. In our region, which is Middlesex, Elgin, and Oxford, there's 13,000 people living with dementia. And in Ontario, there's 275,000. We always take into consideration the person caring for the person living with dementia, which is a care partner. So 1 in 5 people are in that care circle. And a key thing to note about our stats is the numbers are actually much higher because we know that the Ministry of Health, it's a really hard stat to collect. For many reasons, not everybody gets diagnosed and not everybody pursues treatment. So our numbers are in fact higher. The last stat is that 46% of people admit they'd feel ashamed or embarrassed if they had dementia. And this is a stigma that's been in the dementia field for a long time. We work really hard at the Alzheimer's Society to break down that stigma. And how we do that is through education and conversations. You will see us out in the community at fairs, presentations, senior centers, and doing presentations like this, because we want people to be open to discussing any cognitive difficulty and to seek help and support, because that is how we're going to support people and improve their quality of life. I'd like to share a short 4-minute video now. We like this. It's a great overview. It's from the UK. And we'll just watch this together and then I'll circle back.
Dementia is a word we give to a set of symptoms affecting different aspects of thinking and brain function that get worse over time and affect the way we live our lives. Dementia is not a normal part of aging. It is the result of physical diseases that damage the brain. Everything that makes us who we are, our personalities, intelligence, emotions, our hopes and our fears are driven by this incredible organ. The brain is the most complex structure in the known universe. Intricate networks of brain cells, bundles of nerve fibers, and hundreds of miles of blood vessels all work in careful unison to keep us ticking every day. Every second of our lives, nerve cells in the brain are firing. But when these cells become damaged and their connections start to break down, a person can develop dementia. The area of the brain where this damage occurs determines the symptoms a person experiences. If nerve cells in the back of the brain are damaged, a person's vision might be affected and they may have trouble reading words or climbing stairs. If nerve cells in the side of the brain are damaged, communication and language skills can change. There are 4 main diseases that cause dementia. The symptoms of these can overlap, sometimes making them difficult to tell apart. While each disease has characteristic symptoms, these can change from person to person depending on which areas of the brain the disease is affecting. Alzheimer's disease is the most common cause of dementia. Often, one of the first areas of the brain to be affected by Alzheimer's is the hippocampus. The hippocampus controls aspects of our memory and navigation. So, forgetfulness and getting lost are usually some of the first symptoms of Alzheimer's. In Alzheimer's, nerve cells are damaged by a buildup of 2 proteins in the brain, amyloid and tau. These proteins are present in all of our brains, but in Alzheimer's they behave unusually and begin to clump together. Researchers are still trying to understand what triggers this, but it's likely to be a mix of age, genetics, and other factors such as poor heart health. The buildup of harmful proteins is also a key factor in other diseases behind the condition, like dementia with Lewy bodies and frontotemporal dementia. This damage spreads from one area of the brain to another as the condition progresses. So symptoms get worse over time and people begin to find more aspects of day-to-day life difficult. Dementia with Lewy bodies can affect different areas of the brain, leading to a variety of symptoms including changes in attention, sleep problems, and hallucinations. The processes involved in dementia with Lewy bodies are similar to those involved in Parkinson's disease. And people with dementia with Lewy bodies can also develop Parkinson's-like symptoms such as shaking and slowed movement. Vascular dementia can occur after someone has had a stroke or the blood vessels in their brain are in poor health. While the other diseases that cause dementia spread steadily through the brain over time, vascular dementia can progress in distinct steps after an event such as a stroke, slowing a person's ability to think, plan, and pay attention. Unfortunately, there is currently no cure for any of the diseases that cause dementia, and no treatments that can slow or stop the spread of these diseases through the brain. Researchers all over the world are looking for new ways to tackle these diseases and protect precious nerve cells. Their work has the power to offer new hope to millions of individuals and families whose lives are affected by dementia. To find out more, search Alzheimer's Research UK.
Okay, I hope that you enjoyed that 4-minute video. It does give a good overview, and I am just going to highlight a couple of things so that we have a good understanding. So the word dementia that you see in the umbrella, it really is a term that describes a wide range of symptoms that are caused by disorders affecting the brain. Each person's journey with dementia will be unique, and if you've met one person with dementia, you've met one person. The key definition is that dementia is often diagnosed when it changes how a person is able to perform daily tasks. And we'll get into that in the next couple of slides. Alzheimer's disease is the most common, and we're looking at 60 to 80% of people that have dementia will have Alzheimer's. And again, it starts in the hippocampus, which the video shared, which is short-term memory. We often notice with people that it will be a lapse in short-term memory. Vascular dementia is, the key definition here is a blood clot that stops flow and denies cells oxygen. So think of a stroke or an aneurysm. And it causes damage in the brain where that blockage occurs. Lewy body dementia has a lot of similar symptoms. It is a lower percentage. It is a different set of symptoms. So as the video said, it's similar to Parkinson's. So you've got a stooped posture, rigidity, shuffling. You often have a person that will hallucinate, and it's often animals and kids. People will also have difficulty with their sleep pattern. So those are kind of the telltale signs, and memory might come later. And lastly, frontotemporal dementia is another kind of rare type umbrella term. And this tends to be disorders that affect the frontal and the temporal lobe of the brain. So you'll see people having difficulty with personality, emotions, language, behavior. And what's not listed here is when people can also develop dementia if they're younger than 65 years old. That is another group, and we call it young onset dementia. So we can see people in their 40s and 50s with dementia. So with defining dementia, there's 3 key things that occur. So the first is it's progressive. Once that damage happens, it does increase over time. And the neurons will continue to break down, which means it's degenerative. And once that damage is done in the brain, it cannot be undone. So next, I'm going to talk about the signs and symptoms. And this is one of the #1 questions we're asked when we're out in the community, is the difference between normal aging and signs and symptoms of dementia. So we'll review now, and this could be for your personal benefit or for your care circle or anybody in your life that possibly could be struggling. It's really good to know the signs and symptoms so people can seek assistance. So memory loss that affects day-to-day abilities. we forget our keys, we might miss an appointment, but this is more consistent loss that people aren't able to function as well. So missing a doctor's appointment, not recognizing it's a holiday. I had an acquaintance a couple months ago who cooked a slow cooker, cooked sweet potatoes in a slow cooker and forgot, and 2 days later remembered and did eat the sweet potatoes because she couldn't, her memory, she couldn't remember, and of course that was unsafe. So definitely a sign. Difficulty performing familiar tasks. So in our life, in our daily routine, there's a sequence of events we follow to get dressed, make a meal, and we rely on our memory for these things to happen. So at some point, some individuals will find it hard to make a meal, to get the food, the plates, work the stove. It becomes more and more difficult. You'll see problems with language. So in this example, the lady's having trouble identifying the animal. Is it a cat or a dog? You'll see people use shorter sentences, become quieter, and have a lot of word finding difficulty. And that is because the process that we use with language, that part of the brain is damaged, and it's difficult for them to do the recall. Disorientation in time and space. In this example, we can see that the person is logistically having difficulty getting home. So becoming lost in a familiar setting. Again, people could forget what day of the week it is. They might forget a major holiday. It's not knowing when meal times are, even confusing day and night, because their ability with time and space is impaired. Impaired judgment. You will see people, in this example, the lady is going outside dressed inappropriately for a cold day. Other things, people might have trouble recognizing a genuine medical need that needs attention. You'll see people crossing the street at a very unsafe, like in busy traffic. Their judgment is off, so taking risks that they wouldn't normally take. Problems with abstract thinking. So this example is numbers. People balancing a checkbook, they might lose that ability. Confirming or organizing, that might be lost. Picking a time to meet. Anything with numbers and possibly letters, people might not recognize or interpret the same thing. Misplacing things. So again, these examples are more extreme and they're out of the ordinary. So in this example, the lady has clothes hanging in the freezer. You might see a sugar bowl in a laundry hamper. People put things in unexpected places. Years ago, I worked in an Alzheimer's unit, and one of the ladies, before she came into care, after a week, her family went to her house, and she had taken all her pots and pans, and instead of putting them in the sink, she put them in the tub. So she associated the pots with going in a basin, but her translation to how to do that was changed. Changes in mood and behavior. So we will see varied mood swings quickly. So going from fairly calm to upset, tears to laughing. And again, the person can't help this. It's changes in the brain that are causing more severe changes. Changes in personality. It can be subtle or it can be more extreme. So you might have a person who's really become suspicious. And the reason for that is they might have lost their purse, and you walk in with a purse that's very similar, and they think it's their purse. That's what their brain is telling them. People might become unnecessarily fearful. Going to the doctor or going to the dentist, they might react differently than they normally would. And loss of initiative. So people that in the past would have a passion for exercise, take pride in keeping their garden organized, like to have people for a meal. We see people with a loss of initiative. They're not as able or as interested in doing these things. However, if as friends and care partners, if we provide cues and prompting, often the person will be able to continue on once we've gotten them started. So the key thing with these 10 signs and symptoms is every person is different. A person may have a couple symptoms, or they might have many of these symptoms. So it varies. There's no order. There's no prediction. It's unique to each person. And the reason we go over that is because if people are aware that there may be changes, they can seek assistance from a family member, the Alzheimer's Society, a doctor. It's really important to get support if those symptoms are there. So this slide is interesting. It is a brain comparison. And for this activity, I'd like to use the chat. So we'll give Susan a minute to get that loaded up for us. But my question is twofold. If you can please share which brain is the healthy brain and which brain is the unhealthy brain, and the changes. What are the differences you see in this comparison? So I'll give you just a minute to think about that and look at the picture. Okay, and I'm just going to look to the side here so I can see our active chat. Thanks everybody for participating. Fuller brain is the healthier brain. So absolutely, it's the brain on the right. The left brain is damaged. Thank you. Excellent. So, okay, sorry everybody. Perfect. So with the chat, does anybody else have any more comments that you'd like to make? I can chime in too and provide a little bit more. Excellent. Okay, thank you everybody. So I'll just do a little review here. So yes, the brain on the right is healthy, the brain on the left is unhealthy. And a few highlights, we have different colors. So the brain on the right is a healthier color. The brain on the left is smaller. It has gaps. It's got shrinkage. So the shrinkage means that the brain on the left has fewer neurons. So there's fewer connections. And for that reason, the person on the left is going to have a much harder time communicating because they just don't have the capacity or the connections, and the brain is visibly smaller. So the other thing I'd like to highlight is a person, because dementia is invisible disease, we can't see people's brains. And that's why this presentation is really valuable in the fact that hopefully it'll make us more open and aware if a person's having difficulty communicating. We'll talk now about non-modifiable risk factors. So these are the things we can't change. The first is age. Our age is set, and we know that age is actually the greatest risk factor for dementia, as it is for other diseases too. The older you become, the higher your risk. So about 1 in 20 Canadians over the age of 65 does have dementia disease. And then every 5 years after that, your chance doubles. And I did mention too, we have people with young onset dementia, which is more rare, but that's another concern if they're less than age 65. Sex is something that it's non-modifiable, but the idea here is that we don't know everything, but we know that women are more likely to get Alzheimer's than men. And we have some of the reasons, they're unclear still, but some of the contributing factors, women live longer than men. We have hormonal changes, estrogen over our lifetime. And it's thought that women may have more conditions of frailty, and it could possibly lead to an increase in your risk. And lastly, genetics. So they have identified many genes that may increase your risk. There's 3 genes that play a more direct role. However, when it comes to genetics, your chance of familial dementia, getting it directly from a gene, is a lot less than people think. I believe it's less than 5%. And if people are interested in learning about genetics, it's a question that comes up. If you go to our website, which we will provide, it gives a more detailed deep dive into the risk. So modifiable risk factors, this is where we can talk about some things that we can actually change, which is excellent. And it says that about 40% of dementia cases could be modified by lessening these risk factors. So many of these you'll be familiar with, but I will just do an overview because it is interesting. And I'll group them together here just for time. So we've got high blood pressure, which increases the risk of vascular dementia, but it's hard on it damages our arteries, our heart, our blood circulation. And that is why for our heart and our brain, it's really important to manage your blood pressure. Not unlike diabetes, which is another disease that can affect our circulatory system, cause damage to our arteries. That is something that if we can keep that in check, it does help. I'll group obesity and lack of physical exercise. Again, what's good for our heart is good for our brain. Managing our weight and giving our heart and brain a workout is beneficial. I'm going to talk a little bit later about diet. That's probably more familiar to us. High alcohol consumption. So the understanding of alcohol has changed in the fact that at one time they were saying just limit alcohol. Now they're saying limit to abstain. It is a carcinogen that is a risk, and people just have to make their personal choice of how they want to utilize alcohol. Just a couple other neat, interesting things. We're going to talk a deep dive into depression. We're going to talk about traumatic brain injury. So an injury to your brain does increase your chance of dementia. Air pollution is something you might not have heard of, and we don't know the reason, but people that live in a congested area with high air pollution, that adds risk. Hearing loss, we're going to talk about that in depth, but if you think that lack of hearing over time does damage how we interpret things cognitively. So it's really something to be aware of and try to improve. And lastly, social isolation. So we need, as humans, to be connected to others some way. And again, this is, there's not a blanket statement for everybody how much interaction you need, but the pandemic taught us that our brain works best if we're not completely isolated. So we'll talk about that. Okay, so your brain health. So before we get into the interesting part about what we can do and how we'll do it, please share in the chat what you're currently doing for your brain health. And we'll give Susan a second to get us loaded up. But yeah, if anybody can say anything they've done this summer that you think is really good for your brain health, that you're pleased. Okay, we've got exercise and we've got puzzles, which is excellent. We've got exercise, diet, not drinking, and outdoor activities. Excellent. Spending time with family and friends. It's hopefully been a wonderful summer that we've had that opportunity. Oh, learning to play the ukulele and working on French language and learning. Excellent. Music is very beneficial, as is language. So excellent. Great. Thank you, everybody, for sharing. We will hopefully offer some people some other ideas, but thanks for sharing. It helps everybody to think about what they might want to do next. So taking action for a healthier brain. This is a snapshot of some of the things we're going to talk about. And we've heard, through the years, we hear a lot about our heart health. And I think things are really changing, and we're really being progressive because we're really, I'm hearing more and more about brain health. So this presentation is excellent because it gets us thinking about steps we can take. So challenge your thinking. This is a neat slide because it actually depicts our brain working hard, which is a great visual. So the key to challenging your thinking is to try something new or do something familiar in a new way. If you try to brush your hand with your non-dominant hand, anybody that's broken an arm or a leg and has to be creative, that's a lot of work for your brain. New hobbies are totally beneficial. Languages plays a powerful part. Learning anything. Music, it can be an instrument, joining a choir, going to a concert. All of these things really connect our neurons and support brain health. Playing games, we had kind of a resurgent of, Wordle and Sudoku that we saw during the pandemic. Any way that you can use your brain and a little bit of a challenge. Anybody that's had technical challenges, we joke here when we have a technical challenge, which we do, another staff member will say, it's good for your brain, it's good for you to think. So we look at it as a positive. Any challenge, hopefully we can change it into a positive. Education, being a lifelong learner, definitely helps. One example you might have seen in the news is Ron Robert, who has a diagnosis of Alzheimer's disease. He's over 80. and he decided to go back to school. He went to Western and graduated with a degree in 2020. So an amazing feat, and I've heard him speak. He speaks so highly of the challenge of being with students. You can imagine how difficult it would be navigating navigating the campus, interacting, but he did it, and he really says it's really helped his health and his motivation, and really kept him going. So he's our hero here. So there's no magic, it's just daily life. Involve yourself in activities that you're not already an expert at, that you are challenging for you and that you enjoy. So people do ask us, oh, should I do this? Do you want me to do a crossword puzzle? Should I take this up? We always encourage activity, but the key is that you have to enjoy it. So really explore what you might enjoy, and then we know you're more likely to continue on. Staying socially active. We can't minimize, the pandemic has taught us kind of what we lost, but also what we value in social activity. And this level of social activity is going to be different for everybody, because we have introverts and extroverts, and we respect that. But it's looking at your whole social engagement plan, whether it's walking and meeting people on the street, organized groups, connecting with family and friends. Always just evaluate it and try to make sure that it's meeting your needs, because it's a huge part of our collective health. And this is for people of any age. Brain health should be something that we all look at. And staying socially active is for everybody, our teenagers, our working people, people that are retired. So the quote is, being alone is what is risky, not living alone. So this is using, our community resources and really trying to connect, regardless of your situation. And it's that people with satisfying contact with others have a lower risk of dementia. The thing that's key is satisfying contact. So if you put somebody in an uncomfortable situation, unpleasant, or not their ideal, it will have a negative effect. It's actually a risk factor for dementia. So this is a really personal, unique perspective that each individual should look at for themselves. Technology. Can technology help us? The answer is it can. We can connect using technology like we are today. There are benefits. The key is for people of all ages to not have it be our whole social contact, because we do need face-to-face, and technology should not cover everything. So we need to be mindful. Volunteering. Volunteering definitely has its own chapter in our story, because it has such an impact. You have the chance to use skills, previous skills, new skills. It is challenging because you're with new people and there's a variety of things you can do. It is an opportunity to give back to organizations, and you can't help feel a really unique feeling having done that. And I'll ask now, if people have a volunteer role, if you can put in the chat what that is. So we'll just give Susan a minute to get that process happening. But do we have any volunteers on our session? And if you can just tell me what your role is. Excellent. So we've got somebody, family council, vice chair. Excellent. We've got a volunteer that was with us for the Alzheimer's walk. Thank you. I'm a previous volunteer engagement coordinator, so I am so passionate about the difference that volunteers make in the lives of our organizations, of other people. It really is life-changing. And we have another comment of people that call. A person with the VON calls each week. Excellent. We've got people that help with events and education. Excellent. Thank you for that. Upper Thames species at risk, turtles. Excellent. That's a whole other topic. If you're interested in conservation or nature, really, there probably is a volunteer position for whatever your passion is. And I'm always interested to learn what other people are doing and learning about the cause. So our volunteer opportunities, I'll go over these briefly. We have a social component that volunteers can help with, and this is with our clients. So we have the social, which is a group program that our clients come to right here in our office at the 3 locations, actually. Wonderful adult program. We also, because we know not everybody's interested in a group program, we have one-to-one connections in the client's home. And we also have virtual recreation. So let's say that somebody wants to do a puzzle or a discussion. We have that available virtually. Public education, I've touched on. We're always out talking to people and hopefully having an interactive conversation where everybody learns. Community outreach, of course, we fundraise and we share our message. And caring connections. So we actually too have a program where we call clients to provide weekly support. And with so many people living on their own, it is a huge thing that we support people in the home. Adopt healthy behaviors. So eating is important for our brain health. So if you think about eating, it is really the fuel that we give our brain. It helps brain function. The key is to have, a balanced diet that isn't based on any superfood, but really is fruits and vegetables, and that we're really mindful about what we eat. So protecting your heart, we've talked about many ways that you can protect your heart. One thing I'm going to touch on is, of course, going to your doctor and managing your numbers, doing regular checks, but reduce avoidable stress. So that is the key question that we all have, because I think everybody has stress at different times in their lives, different stressors, but we know that stress causes, chronic stress does cause anxiety, and our brain and heart do not work as well under stress. There's a decline in concentration, ability, memory, mood. So we'll talk a little bit about what we can do to manage our stress. So with our heart, we have to be active each day. So this slide is looking at a week to please try to do 150 minutes of exercise a week. And we'll review why, because it's always nice if we know the why, you're one step in the right direction. It's going to help our muscle tone, and your balance will improve. It will help keep your blood pressure in check. It controls your weight, strengthens your bones. It does prevent falls because hopefully you have an edge with some balance. And it helps our mental health and our mood. So our mind and body are connected. And that's why we're always circling to brain health and heart health. And I think the other thing to keep in mind, it can be as simple as always parking at the far end of the parking lot or doing stairs once a day. We're not talking a lot of extra time. We're just talking about chipping away at it in smaller increments, if that's what you can do. Maintaining your hearing. So I mentioned before how important trying to maintain our hearing is. We talk about hearing aids. I know that there's challenges sometimes with hearing aids, wearing them, batteries, finding them, background noise. If you can overcome that, it does help. Protecting your hearing from loud noises, using closed caption also helps. Speaking in a smaller group. All of these things can contribute to hopefully improving your ability to hear. Getting a good night's sleep. This could be a whole webinar on itself, and it's a really interesting topic. The key is to work away at improving your chances of having healthy sleep, because that is how our brain refreshes and gets cleaned. Schedules help. Limiting naps helps. Physical activity during the day will improve your chance of having a deeper sleep. And we have to watch our screens. So your phone, TV, any stimulant does kind of wake us up, and our brain does connect to that blue light. So if we could limit that. And a bedtime routine. So our brain does like routines and knowing what's coming next. And if we can work at creating a routine that tells the brain it's okay to shut down for sleep. Treating depression. So depression is a huge thing that can affect anybody at any age, any time, for short or long periods. And we do need each of us to have a plan to address depression and address our coping mechanism. These are all action steps that you can take that could help to minimize the effects of depression. There is an association between critical thinking and an increase in anxiety and depression. So identifying negative thoughts and reframing is one technique, as is mindfulness. I hear a lot about apps that people use, Headspace, Insight Timer. There's others, but any tool that we can put into our daily routine that's going to help to keep us in the space where we want to be. All of these things, support groups, journaling, routines, socializing, food, music, and to always have a realistic goal. So just to be open and mindful and know that these things or a combination of them could help. Finding purpose. Finding purpose is a really good reminder for us because at any age, we all go through different transitions, life stages, and it's always nice to revisit how you find purpose. Look at what you care about, what matters most to you, and just revisiting your own strengths and talents and what you would like to use. We need to kind of think about what brings us joy and how we can access that joy. There was many things after the pandemic that we did, whether it's watching a baseball game or going to a meal. And if you remember thinking, oh, I forgot how nice this is, how fun this is. So always try to find purpose and revisit what brings you joy. Avoid head injury. So this is something that we need to protect our head. This shows a helmet, which is, of course, probably sports related, but I'm going to share in life a couple tips for keeping our brain safe. These initiatives where it's wearing a helmet, using a walker, wearing a seatbelt, having things in the home that provide a safety option, whether it's grips on mats or more lighting. The reason that we all want to avoid a fall or a head injury is because it does lessen confidence. It does increase your chance of a hospital visit. It does increase your chance of dementia. These are things that you're probably more familiar with. Another good reminder, I'll add to this list because I had a friend, a senior, who went on a trip, and she did fall, and it was because she was in an unfamiliar spot, and it happened so quick. She was carrying something. So to be mindful if you're in new territory, if you're in somebody else's house that you're not familiar with. I talked to a senior who, when he goes to a hotel room, he always takes night lights. So a really good idea, because he's not going to turn the light on in an unfamiliar spot. He might not know where it is. The night lights are a sure thing that he knows he can get to the washroom. So try to think in your own surroundings what you can do. And we have a poll question. So the question is, and Susan will get this loaded up for us, what actions will you commit to doing today to promote your brain health? So try to think about some of the things that we've done, and we have a little list there. We'll give you a second to just kind of click and see what you might go ahead and do and what things are important to you. Okay, excellent response time. We have a lot. We have something in each category, which is excellent. We have high numbers in each category, which is great too. It means that each category is speaking to people. And I appreciate everybody has spoken. So we've got challenger thinking, staying socially active, adopting healthy behaviors, avoiding head injury, being active each day, and maintaining hearing. So this is really good because it speaks that we all have, I'm going to share the results here. It speaks to the fact that maybe we're thinking a little bit bigger, and we all have kind of a plan formulated, which is excellent. So thanks everybody for doing that. I'm going to close the poll, Susan, and we're just going to finish up here because our time is, we've got a healthy 5 minutes, which we can do amazing things in 5 minutes. I'd like to introduce dementia-friendly communities. And a dementia-friendly community is a space. It can be a business, it can be a library, it can be an organization where you work as a team to decrease understanding, reduce stigma, and recognize potential. So that is done by learning and staff spending some time learning and also creating a space. So we're pleased to have Susan on the call, who is a dementia-friendly advocate. We're going to share her email at the end. So if you think as an individual you would like more information, if you are a business or an organization and you'd like to be a supporter, or you would like to innovate. So there's 3 different levels. It's an amazing program, and Susan will be very glad to have a conversation with you and try to connect you with that. Our overview of programs and services. Basically, I'm glad to share that we have the person living with dementia and the care partner in our circle. We have intake process for them where we connect them to services. We have a team of social workers. We have a full education component for clients, healthcare providers, and the public, and we have recreation. So anybody with or without a diagnosis, without a doctor's referral, you can call our office and get support. Anybody, it's open access. Even if you have memory loss, you can call our office and get support. I'm going to go over this quickly, but basically we have care planning for people. So we really are a wonderful resource if you are a care partner, don't know where to start, or a person living with dementia. If you call us, we can get you started. And lastly, finding your way. This is an excellent resource where it gives people resources to live safely and well with dementia. So if this is of note, or if Susan can please put it in the chat, you can get excellent information on a variety of topics. You can get an identification kit, which we do think very highly of. People with any cognitive decline can have a missing incident, and this is an excellent resource that we can have to support safety. There's an interactive guide, which is excellent too, and this is available in different languages. And these are some of the things that you can get more information on. So it all plays a part in brain health, whether it's your medication or your nutrition or traveling. There's a whole package that can be explored on this website. We will do this webinar again often. So if people do want to revisit or share the link, Heads Up is an excellent program. And we are in good time, a little bit short on time. I'll give you a minute just to see our addresses, our email, so you can connect with us. And I'll share one more interesting tidbit before we go to questions. We do have Dr. Bory, who is a geriatrician and really so respected and admired by all of us here. He will be speaking in 2024, a webinar. So please join us or sign up for that when you see the invite. And I will finish there. And I will go to the Q&A. Let's just see if there's any questions.
Anita, there is a question about tinnitus.
Yes.
And I'm happy just to address that just while I saw the question pop up. For the person who asked the question about tinnitus, what I've been able to find, again, it's not something I'd heard specifically, but it looks like there is from one study that was done in Taiwan, they did show a slight increase in risk among those who have tinnitus. I think it was 3.1% of tinnitus patients developed Alzheimer's over a 10-year period compared to 2% of those who did not have tinnitus. But they have a caveat that scientists do not know why this relationship exists, and certainly more research is needed. So good tip to, again, be checking in with your healthcare provider, with your audiologist, and to just in general with hearing, just to make sure that you're on top of that.
Thank you, Susan. I'm going to stop my share now here. I would like to be respectful of people's time. So if people do need to leave, I just want to genuinely thank you so much for spending an hour with us. Susan and I are going to stay on the line. So if you do want to put a question in the Q&A, you can go ahead and do that, or if you want to stay on and just chat, we have time. And I really want to thank everybody for taking the time, for your participation, and for your support and learning about dementia. So thank you so much.